Virtual wards keep hospital beds open by allowing patients to be monitored and treated in their own homes. But this model only works if you have the right people in place to run it. Right now, the system faces a critical bottleneck: a heavy reliance on short-term staffing models and a lack of integrated social care support. To fix this, we have developed a 5-step staffing blueprint. It details exactly who you need to hire and how to structure their roles for the long term. Before you begin, you must analyze your local population's specific health needs. Whether you are staffing for frailty or acute respiratory infections dictates how you build your roster. Without a concrete staffing plan, even advanced technology fails to reduce winter hospital pressures or keep patients safe. Step 1 is mapping out your clinical team. The foundation is a named, accountable consultant physician or an advanced practitioner who leads the ward. To support that lead, you need a flexible, multidisciplinary team, or MDT. An MDT is a group of health and care professionals from different specialties working together. Instead of siloing staff by one medical specialty, you pull from a diverse pool, including pharmacists, nurses, and allied health professionals, specialized clinical practitioners like physiotherapists. Step 2 is integrating social care. Clinical treatment must connect with social support, formally including social workers and third sector staff in your daily board rounds. A major mistake to avoid is ignoring the patient's home environment. If a person lacks food, heat, or assistance with mobility, the clinical pathway will fail. Effective virtual care requires combining clinical monitoring with basic human support. This approach ensures the patient recovers at home and avoids a hospital readmission. Step 3 is shifting to long-term recruitment. You must move away from 12-month funding cycles and temporary secondments. This chart shows how systems must set and review long-term establishment plans. Creating permanent positions makes virtual wards a viable career path for clinical staff. To secure a future pipeline, integrate student placements directly into the virtual ward. This ensures the next generation of healthcare staff is trained in this model from the start. This stability reduces staff burnout, lowers turnover, and retains specialized remote care expertise within your system. Establishing permanent roles moves virtual wards from just an emergency stopgap into a standard component of healthcare delivery. Step 4 is mapping the operational roster. Your baseline requirement is staffing the virtual ward for at least 12 hours a day, 7 days a week. You must also address the out-of-hours gap. Establish nighttime coverage using on-call cardiology or general medicine teams to maintain patient safety when the primary team is off shift. This flowchart illustrates the monitoring process. You need to connect your staffing roster directly to this workflow so that human resources support the technological monitoring loop. Map exactly where on-call staff intervene if the incoming data triggers an alert. As a success check, verify that your roster includes a clear, documented escalation path for a patient who deteriorates at 2 in the morning. A remote monitoring platform is only effective if there is a human response ready to act. Continuous coverage is the only way to guarantee clinical safety. Step 5 is appointing virtual ward champions. Rosters alone do not change clinical culture. Enthusiastic senior clinicians do. The champion's role is to spread awareness across the hospital to build systemic credibility for the virtual ward model. These champions address peer anxiety. They help other consultants overcome the reluctance to assume the risks of discharging patients to a virtual environment. The champion acts as a bridge to the emergency department, primary care, and SDEC. SDEC stands for Same-Day Emergency Care, a service where patients are assessed and treated without being admitted to a hospital bed. Empowering champions ensures the virtual ward is a trusted pathway that the wider hospital ecosystem actively uses. Our 5-step blueprint includes a consultant-led MDT, embedded social care, long-term recruitment, secured out-of-hours coverage, and empowered champions. Your immediate action: take this framework to your next Integrated Care Board, or ICB, planning meeting. The ICB is the organization responsible for planning and funding health services for your local area. At that meeting, initiate 2 tasks: formally audit your current social care partnerships and begin transitioning temporary digital roles into permanent positions. Sustainable staffing leads to reliable care. By building a stable workforce, you ensure hospital beds remain available while allowing patients to recover in their own homes.